If you are a man watching this video, you probably have or will have sexual dysfunction in your lifetime. It may be ejaculatory disorder, decreased libido, or erectile dysfunction. Now what if I told you that talking to your doctor about this could save your life? In this video I'm going to focus on erectile dysfunction, why it happens, and what you can do to prevent it. If you need medication, what are the options? I could show you some numbers and statistics that a few of you might find interesting, but the fact is, the older you are, the more likely you will suffer ED. If you're in your 60s or 70s, there's a 40% chance that you've experienced some problems in the bedroom. If you have coronary artery disease, you have a 75% chance of ED. Let's say the mood is right and the lights are low and an erection is called for. Your body has to massively increase the blood flow into your penis from just a trickle to a very strong flow. Not only that, but the body has to trap the blood there to maintain the pressure and to get and keep your member rigid. But this time, it doesn't work. There are a lot of potential reasons, but most importantly, and potentially life-threatening, is vascular disease. If you remember anything else from this, erectile dysfunction may be a sign that you have the beginnings of heart disease. And remember, when you have that heart attack, there's a significant chance you'll die from it. Let's go on. To get an erection, there has to be adequate blood flow. But not only that, but normal neurological function and the absence of inhibitory elements. What do I mean by that? Well, pain, stress, fatigue, intoxication, and anxiety are a few. To initiate an erection, there needs to be some stimulation. When a mental or visual or some other central stimulus is relayed by neural signals to a spinal cord center located in your back at T11 to L2, that then sends impulses to the pelvic vascular bed and directs blood into the corpora cavernosa, which you could think of as the inflation chambers. Interestingly, reflex erections created by tactile stimulation activate a reflex arc in the S2 to S4 sacral roots and send similar impulses to the vascular bed. As you would expect, psychogenic erections are more common when we are young, while reflex erectile activity dominates in later years. So when we get these signals in the presence of hormones and other factors, the release of neurotransmitters are triggered, including acetylcholine and nitric oxide, which promotes dilation of the muscles in the corpora cavernosa, giving us a 6 to 7-fold increase in blood flow. So we have blood flow, then what? A crucial thing then happens, and the vascular outflow decreases, allowing the chambers to stand and become pressurized. Nitric oxide in the corpora cavernosa and cyclic GMP work to prolong and strengthen an erection, while their breakdown causes the loss of an erection and the return to a flaccid state. So when it comes to erection, nitric oxide and cyclic GMP are good and help maintain the erection. And that again brings me back to why we're talking about how ED symptoms could save your life. If a man has blockages and can't get enough blood flow into the penis, even with the nitric oxide and cyclic GMP, he could just as well have blockages in his coronary or cerebral arteries. ED may be an early warning sign. Don't let it go unreported. If you are at or near a hospital and have a heart attack, your chances of survival are good. If not, then not so good. Next, I'll talk about the treatment for ED. Before the late 1990s, treatments included vacuum pumps, penile injections, surgical implants, various herbs including yohimbe. These treatments were either ineffective, expensive, painful, or not very spontaneous. The good news is over the last 20 years, medications have become available. You probably know the first three is Viagra, Levitra, Cialis, and the last one, which you may not have heard of, is called Stendra. They are all phosphodiesterase 5 inhibitors. They all basically work the same by blocking the breakdown of cyclic GMP. So these medications improve the erectile response when there is stimulation. They do not necessarily cause an erection if there is no stimulus. And these medications are also used for non-ED related medical problems. But the problem with these drugs is that if there is nerve damage and no stimulation to make cyclic GMP, such as in diabetic nerve damage, prostate removal, multiple sclerosis, they really don't help much. But some men with spinal cord injury can still achieve erections by manual stimulation, thanks to the spinal reflex arc that I mentioned earlier. But here's a fun fact. Sildenafil, marketed by Pfizer under the name Viagra, got FDA approval in 1998. Early on, the retail price was around $50 per pill. As of 2022, the brand name Viagra, 100 milligram, goes for $100 a pill. It is still prescription, but you can get a bottle of 30 generic sildenafil, 100 milligram, for less than $13. The brand name Viagra costs a whopping 230 times the generic. So when a doctor like myself sees a man with ED, they don't necessarily have the same cause. It may be poor blood supply. It may be that the nerves aren't sending the signals they need to. It could be stress or pain or drugs or alcohol. Those kind of things need to be sorted out. Their ED may be due to low testosterone. Testosterone does play an important physiologic role in sexual functioning, but contrary to some advertisements, raising it does not automatically make you a better lover. Stress can have a big effect on sexual functioning. If you're tired or stressed out or anxious or in pain, you may have difficulty getting and maintaining an erection. You probably heard of the fight or flight response. It's an autonomic physiologic reaction when we have something that is perceived as stressful or frightening. It activates the sympathetic nervous system, which releases adrenaline so you can fight or flee. The surging adrenaline reduces blood flow to the genital area and causes an immediate loss of an erection. So if a guy has a new partner that he wants to impress and gets all nervous, he may not get a good erection because his adrenaline is circulating, and it actually reverses the effect of getting a normal erection. It is well known that certain prescription drugs can also cause erectile dysfunction. First, and most common, antidepressants and other psych drugs. Probably the most common one that I see are men on SSRIs like Prozac or Paxil, but tricyclic antidepressants like amitriptyline and nortriptyline commonly cause it, and certainly antipsychotic drugs will. Next, blood pressure meds. With the variety of choices we have today, that really isn't a huge problem. But still, beta blockers, particularly propranolol, and some of your diuretics can cause ED also. Then there's opioids, which is your pain medications, alcohol, cocaine, and other recreational drugs can interfere with normal sexual function, as can chemo drugs for cancer and drugs for Parkinson's disease. Be aware that some over-the-counter drugs and prescription antihistamines like cimetidine, ranitidine, hydroxyzine, diphenhydramine, which is Benadryl, and promethazine or Phenergan interfere with normal function. Other than meds, there are modifiable factors that are associated with ED. Having more than 2 drinks of alcohol per day, smoking, obesity or being overweight, lack of exercise, watching TV more than 8.5 hours per week. The truth is, in most men, it's a combination of causes, whether physical, emotional, hormonal, or behavioral. And although our ED drugs help in most cases, they don't work in all of them. I don't think I've mentioned it already, but uncontrolled high blood pressure is highly associated with EDs. So guys, if you want it to work in your senior years, control your blood pressure. Compared to your coronary arteries, the size of the blood vessel to your penis is much smaller, so they're much more prone to get blocked. Again, that's why we think it's an early warning sign for heart disease. Talk to your doctor. In our give me a pill or shot culture today, only a few of us want to hear that we need to do things like exercise regularly and achieve and maintain a normal weight, quit using tobacco, and stop using recreational drugs. When I prescribe Viagra or Cialis, I'm usually improving a person's quality of life and sex life, but sadly, it is not reversing the underlying condition. Some men ask if there's a diet or a food that will cure ED to improve things in the bedroom. The answer is no and yes. Many articles claim that certain foods or supplements are a natural cure. The lists usually include garlic, citrus fruit, beets, blueberries, fresh meat, dark chocolate. I don't claim that these are not beneficial, and you can get helpful flavonoids in some of them, which can be a part of a healthy diet. But there are no magic diets or foods that you can take that will fix things in the bedroom. But avoiding highly processed food in favor of a fresh and whole food diet is known to improve most health parameters. So that's what I recommend. Okay, I'll talk briefly on the specific medications and their differences. If you don't want to hear about the meds and you think I'm shilling for Big Pharma, you can click off now. But as I said, sildenafil was first approved and marketed in 1998 by Pfizer. It had been in development in the early 90s as an antihypertensive drug. In studies in England, they found that it didn't do a good job of lowering blood pressure. They knew it had an effect on dilating blood vessels. Apparently, the men in the study didn't want to give back the study drugs because they had found that it improved sexual functioning. As is often the case, a drug ended up being used for something that it wasn't originally intended. I lump Viagra and Levitra together for the most part. They work about the same and give an approximate 4-hour window of improved sexual function. Men do notice, though, that after they've taken it, there may be some residual effect. Whether it's chemical, vascular, or psychological, it's hard to know. But Viagra is approved at 25 milligrams, 50 milligrams, and 100 milligram tabs. Since they all cost about the same thing, I usually prescribe the highest dose and tell guys that they can take a pill cutter and half it or quarter it as needed. Sildenafil also has a secondary indication for pulmonary hypertension, which is dosed at 20 milligrams 3 times a day. Levitra comes in a 2.5, a 5, a 10, and a 20 milligram. Cialis, which is tadalafil, comes in 2.5, 5, 10, and 20 milligram. It has the advantage of a longer half-life, and it may last up to 36 hours. The 10 and 20 milligrams are typically used on an as-needed dosing with a max dose of 1 per day. Cialis is also FDA approved for a daily dose of 2.5 or 5 milligrams. It's also indicated to improve prostate function in men with BPH, and it's dosed at 5 milligrams daily, irrespective of whether a man has ED. So what about side effects or adverse effects? Other than the differing duration of action, they are similar for all of them and usually mild and only temporary. These drugs are known to cause dizziness, rash, vision changes, upset stomach, or limb pain, to name a few. They also carry warnings about prolonged erection and potential allergic reactions. I often hear versions of this question. Well, can I take ED meds? First, if a man takes nitrates of any forms, regularly or intermittently, then no, they are contraindicated, since the combination of nitrates and PDE5 inhibitors can cause a severe drop in blood pressure. And as we know, men can have an MI and die during sex, whether they take ED drugs or not. As for the common side effects, most are due to the vasodilatory effects of PDE5 inhibitors, similar to the effects of nitroglycerin. The 3 most common are flushing, headaches, and dyspepsia, which again is the indigestion. And these occur in 12, 11, and 5% of cases respectively. Other than those, there are rare but serious side effects that could include priapism, temporary blue vision, hearing loss, and others. Apart from the nitrates that I mentioned above, the primary drug interaction of concern is in men taking alpha blockers, usually for BPH, but sometimes for hypertension. In that case, the lowest possible dose is usually prescribed, and the man is cautioned that he might have a greater drop in blood pressure due to the combination of both drugs. If a man's in his 50s or 60s or 70s, then his medical history is very important. Current meds and comorbidities certainly should be considered. The question of can an older man take an ED drug is similar to the question we get about sex after a heart attack. The usual wisdom is if a man is healthy enough to walk up a flight of stairs without shortness of breath, he's healthy enough to have sex, as long as it's with his usual partner. I know this topic is something that a lot of men are interested in or need to hear about, and there's a lot more detail that could be explored, but that's enough for right now. If you have any questions, please leave them in the comments below. I always appreciate your like. Subscribe if you want to hear more. Thanks for watching.